All right, I think I'm live now. So I am so excited this evening to be speaking to Dr. Carla Devlin. Dr. Devlin is an NHS GP based in Northern Ireland, and she's one of those people who I met via this platform and who I think is just incredible. She is such a warm and kind person. It's always a pleasure to hear her speak, and she's just so knowledgeable about so many different topics, including women's health, including aesthetic medicine. She knows so much about skincare. I'm just going to get her to join now. Hopefully this will work. Give me just... We'll see. So, fingers crossed that technology does not fail me this evening. But as I said, this is one of those conversations that I've been looking forward to. Hello. Oh, and then I think we might have lost her. All right, let's try this again. I'm going to get this to work. Right. Let me send the request through. And then, fingers crossed, it's going to work now. So, if, as we're trying to sort out the tech issues, if you have any questions for Dr. Devlin, pop them in below, and we can answer any of them when we're able to get this working. Let me just have another attempt here of sending that request through, and hopefully this will work now. Again, fingers crossed. This is what always happens, isn't it? You do something live and then it's a... Oh, hello.
Hi.
How are you?
I am very well, thank you. How are you?
I'm doing well. Did you have a nice Easter and bank
Good.
holiday?
Yes, it was lovely. Really, really lovely just to be able to get some time off. But yeah, back to work then. Well, today, tomorrow. So it's lovely just to get the break. What about you? Did you have a nice Easter?
I didn't do much, to be honest, because I was working.
Yeah.
From Friday I've been working, but I've been doing day shifts, so
Good.
kind of a nice, yeah, not too bad of a schedule. It's quite a
Yeah.
normal schedule if you're able to do a day shift.
I know you recently had nights there, didn't you?
Yes, and for some
Mhm.
reason I've signed myself up for quite a few nights all through April, so I have that to look forward to.
Ah, I'll have to say I don't miss those.
No, I know, they're brutal.
They are.
So I was doing a little introduction for you, but now that I've got you here, I was wondering if you could introduce yourself to anyone who doesn't know you or hasn't encountered you before.
Yeah, sure. So, my name is Dr. Carla Devlin, and yeah, I'm a portfolio GP, and I've got 15 years clinical experience. So with being a portfolio GP, I have a number of different roles, Emily. So yeah, so it's basically a collection of everything, and I own my own skin and aesthetic clinic, Berkeley Aesthetics as well. So yeah, that's pretty much me.
It's amazing. So you've got quite a few different things that you do.
I do.
Um, so starting with GP and GP training, did you always know that you wanted to be a GP?
Yeah, I mean, okay, I think with GP, you definitely, it's a specialty where, you really have got to be very, very committed to it. So, yeah, from a very, very early onset during medical school, I knew I just wanted to do general practice. And I think though, whenever you qualify, I don't know about you, whenever you qualify, but it's not really until you start working in the jobs that you realize what you want out of your career, and maybe what you thought in medical school would be the career for you maybe doesn't end up being once you've actually worked in it. So yeah, from the very start, it was always general practice, and I have to say, I loved all of the different specialties. So I find it quite difficult to choose which one I loved the most because I loved all of them. So I find then that general practice was just the perfect one for me.
And general practice, it's great if you love everything because you see everything, don't you? You never know what's going to walk through the door.
No, it's I suppose I always say that my ourselves and A&E doctors tend to be the front house ones because yeah, you literally do not know what's coming through that door. So yeah, you have to be very open-minded, kind of flexible in your thinking, you're pretty much like a detective, because you're constantly trying to work out what is important to maybe refer on or to get our other colleagues involved in, and what is normal. So it is a lot of detective work, which makes it a very busy job.
Yeah.
Mm-hmm.
And then obviously COVID has really changed a lot of things, for everyone, but especially for GPs. What has it been like working through the pandemic as a GP?
Yeah. Uh, I've thought about this many times. I mean, I would say life changing. It has definitely been life changing for so many reasons. Um, I did actually recently an article about it when I kind of reflected upon my time. Kind of a year on, the British Medical Association had asked me to do a bit of an article on it, and I just felt overnight, just overnight on the 12th of March, everything changed. And I suppose the mentality of what we were doing in general practice was we knew that patients needed to be seen, um, with COVID, obviously, but we also knew that kind of our general medical problems were also going to be needing to be seen. So I remember, in and around the 12th of March, it was just late nights. I remember, and I'm also a member of a committee called the NIGPC, which is Northern Ireland General Practice Committee. And there were lots of late nights thinking about how this was going to change for us. And the best way to describe it in very, very simple terms, Emmaline, is that we knew that kind of our COVID patients needed to be seen in a COVID type secure, highly infectious controlled areas. So COVID centres were born out of that. And then we knew that the general medical services needed to continue. So we deemed our GP surgeries as the safe areas for them to be seen. So essentially, the doors, I suppose, yes, they did close, but they closed because we needed to ensure that everybody that entered the GP surgeries were essentially non-COVID, so that we didn't basically infect more and more people, and then obviously the pandemic got out of control. And we had to keep our staff safe as well. I mean, we had to basically very quickly train all of us up into how to deal with this. So I mean, it was incredible at one point, emotional. It's been emotional. It's been exhausting. But we've got through it because that's what we do in medicine. We just get on with the job. And, I have to say, my colleagues I believe my colleagues in intensive care have been the real heroes in all of this. They have just been incredible.
Yeah, they
Um,
have.
yeah, so I think that we have really stood as a profession together. We've really become united. And I think moving forward, we are going to be a better profession for it.
I love that. I think that's a really beautiful kind of sentiment to take out of this.
Mm-hmm.
And so you've mentioned the committee that you were on, and
Yeah.
is this a committee you're a member of, or was this the North Belfast GP Federation? I know you're the chair of it, and I know
Yeah.
you're the youngest chair that
Mm-hmm.
they've ever had, and one of the only female chairs. So is that a separate committee that you were just mentioning?
Well, yes, but I have to clarify, I'm not the only female. I'm the youngest, I have to say, but I have two fabulous female GPs, Dr. Frances O'Hagan and also Dr. Ursula Mason, who are also female chairs. So they got there first, but I'm the youngest, I suppose. I can get that title. But yeah, so I suppose it's probably bringing you back to where it all started, Emily. When I came, I kind of graduated from Queen's University, Belfast, so that's where I went to medical school. And as I said to you before, I knew that I was always wanting to do general practice. So after I completed something similar to what you would have done, which is the 2-year foundation program, I went straight into doing the 3-year vocational GP scheme. Um, and I suppose it's slightly different nowadays. People maybe aren't going into training programs maybe like we would have done
Yeah.
back then, but I very much wanted to get onto a training program. So, as part of the GP training program, you basically do lots of different, you work in lots of different specialties that will complement your day-to-day life and working as a GP. So I would have done, emergency medicine, child health, general medical, which probably it doesn't, it's not really as existing anymore. It's all specialty based, but we did general medical, mental health. So we did a lot of different ones. And then during that time, I did a diploma in mental health at that time. So I knew I wanted to further, do a bit more in my career with regards to mental health. So then after I completed the GP scheme, I kind of thought, oh, this is before this committee, because the committee is something I kind of got on to years after. But I started out doing education. I don't know about you, Emmaline, but education is just, it's just my passion, is to basically educate the next generation. I think when you become a doctor, I think as part of your oath, it really is to kind of give back what you have learned. And I kind of did that. And I'm the daughter of two retired senior teachers in grammar schools here in Northern Ireland. So kind of education is in my blood. So whenever I was kind of going through the 3-year vocation training, I also was a clinical tutor in the local university here. So yeah, that's a fun job. Medical students, do you do medical student teaching or anything?
I did a lot last year. Last year
Yeah,
I was working for RCSI as a surgical tutor and lecturer, so I
yeah,
did loads and loads
it's
of tutoring
fab,
with the medical students. It was
isn't it?
brilliant. Yeah,
Yeah.
they're great.
And it's brilliant just to see all these guys just blossom, because I would do all of the years. So it's lovely whenever you get to see them kind of first and second year and then kind of growing up into the others. But you're right. So the committee I'm on at the minute, that kind of came at that point of my career, which would have been after I kind of qualified as a GP. So the NIGPC is the Northern Ireland General Practitioners Committee. And essentially what it is representation of GPs across all of Northern Ireland. But I didn't start there as I am now. So in general practice, you have GPs that are called sessional GPs, which are essentially locum GPs and salary GPs. And so back then when I qualified as a GP, I was a sessional. So I gained a seat as a sessional GP in the NIGPC committee. And that was absolutely brilliant, because I got to then go over to the BMA, or British Medical Association, over in London, and I got to see loads of doctors from England, Scotland, Wales, and it was actually brilliant to see such diverse doctors, and what they were experiencing in medicine, and then me kind of advising what I experienced in medicine. And although we had some similarities, we had a lot of different changes as well. So it was just brilliant to be able to do that. But I knew I wanted to kind of, I sessioned for about 5 years, but that was only really in preparation to be like a GP partner, Emily. And that's when I kind of went back on to the NIGPC committee as a GP partner. So we kind of represent the profession on key areas and key topics as best that we can. But the goal is always to improve patient care. So that would be that committee.
So what sorts of things do you do with the committee?
So we will look at things like GP contracts, about patient care, how we can improve patient care, how we can look after GP practices and support GP practices, not just locally in Northern Ireland, but also across the UK as well. So most recently, obviously, we've been heavily involved in the COVID vaccination programme. But I mean, there's just an extensive list of things that we are doing in the background to be able to improve patient care within Northern Ireland. So the NIGPC committee is just, I absolutely love it. I've done 2 sessions so far with them. So I kind of got re-elected onto the committee back in 2015. So it's been brilliant, because those guys have become mentors for me in being able to develop my leadership roles. Since the last 15 years, I've been developing leadership roles within Northern Ireland and within primary care, and they have been fantastic supports, which then kind of led me to being chair of the North Belfast GP Federation just in the summer there.
That's amazing. I love that. So you take on leadership roles, and do you still do a lot of teaching?
Yeah, so I gosh, the education is definitely ongoing. I do the undergraduate, so I teach all years in medical school. So I do kind of go skills teaching, but I also am a clinical teaching fellow. During my time after GP training, I decided to do a master's in medical education. So I teach the senior part of the school, and we do kind of during their GP attachments. I'm the echo and the CCTV lead in Queen's, and also what we do as well is we teach them on a human factors course or human science course, which is really developing their skills of emergency medicine, prescribing issues, but also human factors, as you know, which are so important as part of your role as a doctor, is to be aware of your human factors. So those would be the kind of the main areas that I'm doing teaching. But also when I became a GP partner in 2015 in the practice that I'm in at the moment, Shankill Road Surgery, um, I became an accredited GP trainer by the Northern Ireland Medical Dental Training Agency. So I train doctors to become GPs, and I'm also an out of hours GP trainer. So those are some of the roles that I do in terms of education.
It's amazing. So I feel like almost at every level, you have a hand in sort of teaching,
Yeah,
no matter what sort of level you're at or stage you're at in your training,
no,
you see it all.
yeah.
And when you talk about human factors, for anyone who isn't familiar with that term, what do you mean by human factors?
Yeah, so I suppose it's about you as a doctor and being aware of things like your cognition, your metacognition, so your thinking, your type 1 type thinking, your type 2 thinking, about confidentiality, it's about ethical principles, it's about time management, it's about prioritization, being able to do the job and being to be able to prioritize your daily tasks of being a doctor. It involves team building, team management, active followership, so you can be a leader within a team, but you also need to be led by a leader. And yeah, so it's all about the skills that are the non-technical skills. So your technical skills as doctors, obviously things like your ABCDE approach to an acutely unwell patient and prescribing issues. Those are technical skills, but the non-technical skills are hugely important to be able to be a really good doctor, but also to have sustainability in this career, because it's a challenging career. It's the most rewarding career, but it can have its challenges, and you've got to be able to manage those challenges. And I think human being aware of your human factors enables you to do that.
And I think that's such a good point because in a way, it's not what you think of when you think of medical school or training to be a doctor. The first thing that pops into your head is, oh, learning your anatomy and physiology, your
Yeah,
disease pathology, learning how to prescribe, learning some skills. But actually, there's so much more that's involved in being a good and competent doctor.
absolutely. And you've got to be open and aware of that yourself. And that's, one of the other roles that I do is I'm a GP appraiser. So each year I would take on 50 GP appraisals. So we look at their continued professional development, but it's not just about their continued professional development. It's about how reflective that they are as a doctor. When they, to look at times when things have gone well, to learn from that, but also to look at times when things haven't gone so well and to learn even more from those times. And I think that's really important as a doctor, is to know, to be open, to be learning about yourself and about your practice, because that's how you grow. That is how you become a better doctor, is to be reflective.
Absolutely, yeah.
Mm-hmm.
So the other thing I wanted to ask you about is Berkeley Aesthetics because,
Mm.
as you said, you've got this great portfolio career. You do so many different things. I don't know how you find the time to do everything, but you've also got your own clinic.
Yeah.
So how did Berkeley Aesthetics start? And did you always know that you wanted to, do um, that in addition to your NHS GP job?
Yeah, I mean, gosh, from a early uh, kind of stage, I absolutely loved dermatology. And then I obviously became a GP, and so many of my consultations are skin related. And I just knew it. I knew that I loved cosmetics. I loved everything about it, but I also wanted to bring, I suppose, an ethical approach to the industry as well, and to add to that. So I wanted to kind of really show my extensive knowledge and skills within a skin and aesthetic clinic. And I had a very clear vision about what I wanted to do, but I made a very conscious decision that I wasn't going to start that clinic until I had finished my exams. So when I did my foundation training, and then I went in and I completed the vocational GP training, and then became a member of the Royal College of General Practitioners, then I knew I was ready to be able to do the clinic. I felt I had gained the experience of it. I wasn't going in lacking that knowledge, but also it's quite a scary experience, opening up your own kind of new clinic as well. As you know, as a doctor, we don't get taught business skills. So, in 2015, when I became a GP partner in my surgery in Belfast, I learnt how to run a business because it is a small business. So I was able to manage finances, I was able to manage the staff, I was able to develop the practice, and still work and have high, effective patient care. So I used those skills to then bring that to my Berkeley Aesthetics. And as I say, I had a very clear vision about what I wanted, how I wanted it to run it, what I wanted, what treatments I wanted in it, what kind of skincare I wanted in it. I researched it to the nth degree. And I just knew that it was the right time. And so I made the step, and I run the clinic in addition to being an NHS practicing doctor. But I think that's really important for me. It's important to remain an NHS doctor along with it, because I think it complements it so well. And then within Northern Ireland, I don't know if you know, Emmaline, but skin cancer is #1 cancer here in Northern Ireland. So you feel, particularly in general practice, you do so much health promotion that I felt it was just a natural progression to go into a clinic where the #1 thing I wanted to do was to try and help reduce those rates of skin cancer, and everything else would develop amongst that.
And actually, I love that ethos that you described, where you weren't going to jump into this without, being very well trained, knowing that you were very well educated, you knew your stuff, you were experienced, and then you would look at opening the clinic. Because I think, this is something that comes up a lot, but medical aesthetics in general in the UK is not very well regulated. I think it's something that sometimes people go into maybe a bit cynically, or maybe they think, oh, this is a good money maker. And that, as a doctor, that's never, ever what we are trying to do or should be trying to do. It's about our patients, looking after them, advocating for their health, their skin health. I think there can be a lot of, or there is a lot of beauty in aesthetic treatments in terms of how they can improve someone's confidence. But again, that has to be tempered with, are we acting in the patient's best interest? I'm never here to sell a treatment or product to a patient. So yes, I love that ethos.
I agree with you, and I think that can be quite difficult in that, with our ethical principles. I mean, whenever you go in, and when you go into your aesthetic clinic or your skin clinic, you have taken your oath, you abide by your oath, and just because you're in private medicine does not mean that that goes away. It's even more important that you make sure that you adhere to that. And so I would be very strict in ensuring that the clinic is represented by good ethical principles, because I couldn't do it if it was, if it wasn't done that way. And I think for patient care, you need to have a very, very strong ethical principle. So yeah, I mean, that would be the motto of the clinic.
And so for your clinic, do you have any sort of favorite treatments or favorite areas within your clinic that you really enjoy practicing?
Gosh, I love all of it. I love all of it because I did a treatment on myself last night, so it was it was great. What do I love? I suppose probably my favorite is the skincare, and I'll tell you why. I mean, it's because the transformation that you can give patients' skin, with their confidence, their self-esteem, it's quite incredible, the difference that you can make to people's lives in being able to correct their actual skincare. So for me, probably the most rewarding is definitely the skin aspect of it, and using, I mean, we have a shared love of Epion, so I do use a lot of Epion's because it gets me the results that I am looking for, and so that's what I love to use. And obviously, you and I being doctors, we love that it's going to be evidence based as well. So I definitely love the befores and afters in terms of the skincare. In terms of the treatments, that's a hard one. Probably the chemical peels, I think, are probably one of my favourite. I would do a range of chemical peels, so you maybe have lighter peels, kind of medium depth, and then very much deeper peels, TCA peels, and I do dermafrac microneedling. I also do Aquagold, anti-wrinkle injections and some fillers, but definitely I believe the most rewarding are probably the chemical peels, dermafrac, and the skincare is the bit that I love. I love the befores and the afters.
Yeah,
I really
they're
do.
amazing.
Yeah, and it's amazing. It's amazing how many people get down, about, and their mental health is affected by how they perceive themselves or how they feel that they look. It is quite incredible, and I suppose that's with my other kind of hat, which is my extra qualifications within mental health. I probably believe that blends really nicely with the skin health, because there are so many, even chronic, long-term conditions that affect your mental health. So skin, perfect examples would be psoriasis or eczema. And we know as doctors that obviously psoriasis doesn't just or isn't part just of the skin, that it can affect the joints as well, the psoriatic arthropathy. So kind of being aware of other things. So that's why whenever you come to the clinic, it is a holistic approach. So when I'm taking a medical history from you and making a medical judgment or assessment, then I'm getting the whole package. I kind of go into GP mode a lot, which is my patients always laugh because they maybe tell me something about their thyroid, and then I'm like, have you got your thyroid, your TFTs checked? Because I can't help it, because it's a holistic approach. It's not just me selling you skincare and me kind of doing treatments on you. It is actually looking at you as a whole.
Yeah. And again, our skin, it very much can be a reflection of our health overall. And I think it completely makes sense that it can be tied in with our mental health and our, self-confidence to such an extent because,
Yeah,
your face is the first thing you present to the world. All
yeah.
our faces, they tell a story, and it can have a massive impact on patients.
Oh, absolutely huge, and as I say, obviously you're like myself being a doctor. Again, what you're getting is, in a sense, maybe you're diagnosing something else that maybe the patient didn't realize that they had. So maybe they have some, bowel problems. Maybe they have some thyroid problems. Maybe they have some gynae problems, and actually what they're presenting with is a skin problem. And actually, when you look at it as a whole, then you realise that actually it's all interlinked. And that goes back to being a GP, where you've kind of this detective. It's about piecing it all together and kind of getting the puzzle all kind of in one bit. And that I find fascinating, absolutely fascinating.
Yeah,
But
it's
obviously,
detective work, isn't
yeah, it is detective work. I think that's why it can be quite exhausting, is because it is
it?
detective work, and you're constantly, you're constantly thinking, your mind is going all of the time. So it's important then, whenever you're doing all of that and you have such a busy lifestyle and you're kind of spinning the plates all the time, that you make sure that you kind of have, downtime, and make sure that you take that self-care, because if you don't, then you can burn yourself out. So it's just making sure that you're aware of what your triggers are for yourself, and to make sure that you look out for them and deal with them if that ever happens. But yeah, the skin clinic is really, really good fun. I absolutely love it.
And at the moment, how is your typical week structured? How do you split your time between your NHS work and everything else you're doing? Your leadership roles, your teaching, your clinic?
Yeah. Oh, well, I suppose. Yeah, I probably have at the minute about 15 different leadership roles. so it's busy. Um, and I do the clinic, obviously. I never stop working, is the answer to that, Emily. But I think, do you know what? I think it's either in you or it's not in your work ethic. I mean, I've been working since I was 12 years old. I have not stopped since I was 12 years old. So I think it's this in you, and I think I've been brought up to have a good, strong work ethic and commitment and dedication to things that you do. Um, Time management has got to be key. You've got to be able to manage your time well, and you need to make sure that you have compartmentalization of your time so that you take a kind of a period of time and do something and complete the task and then go on to something else. So I have lots of timetables. I'm sitting here looking at a whiteboard. I just have it all. You can imagine it's definitely a type A personality. There's coloured pens, there's coloured stickies and everything.
Oh my gosh, that sounds like my room.
Oh, we're really bad for it, aren't we? But yeah, so that things like that, time management, and making sure that you are just carefully kind of planning your things, and there's no question of a doubt. I couldn't do what I do. I could not do what I do without the help and support of my family. They enable me to do it, and that is just priceless, really. So yeah, and the encouragement and the support of patients, and that's patients both in my GP practice, but also my Berkeley Aesthetics practice as well. That positive feedback. I always have an appetite of wanting to do more and to want to make a difference. And I don't think that will ever go away. I think it's just in you.
I think if it's something, that you really genuinely love, and that you get immense satisfaction from, all those extra hours are not a chore, are they?
No, you couldn't, you couldn't, whenever you do medicine, you couldn't do this job if you didn't love it.
Yeah.
And I honestly, passionately love every aspect of my job, and I care for all of my patients. And I think that you just have to put in that time and commitment. But it's feedback. It's getting, it's people appreciating what you're doing as well that allows you to be able to do it. I actually had a phone call there. I was doing the baby clinic on last Tuesday, and one of my staff had asked me to come to the telephone. I was like, okay. I was all dressed in a PPE, and I was like, okay, stick the phone to the ear. And then on the other end of the phone was actually one of the final year medical students, a young man who had passed his finals, and he rang me up. I had taught him whenever he was in second year, and then he did his finals and he passed them, and he rang me to say thank you so much for the time that I had spent with him in second year and also in finals, because he had been attached to the practice, and that he had said about the teaching and how much that he had benefited from it, and that he will always bring the skills that he had learnt through his career. And I just thought, what a lovely, lovely thing to do, to lift that phone and actually tell somebody how much that you appreciated what you had got. And that type of thing, that makes me keep going. That
Yeah.
makes me want to do all of these roles. And as I say, there's just every single part of my career, I want to make a difference to patients' lives. I want to make a difference to the profession. And I want to make sure that primary and secondary care, that's my next thing, is the primary and secondary care, that we integrate more, that's what COVID actually did. Over here in Northern Ireland, the Department of Health had wanted to basically reform and rebuild services during the pandemic. And I'm a member of a committee called the GP Consortium within Belfast. And we are representing GPs, there's 12 of us, and we're working with secondary care to be able to develop new pathways. So, for example, I'm on the urgent care and the unscheduled care, which means kind of the emergency type medicine stuff. And also, I had already developed a cardiology pathway in Belfast, but now we're hopefully aiming to go regionally with it. So, It's all about building for patient care, and that's what the whole GP Federations, which I'm a chair in North Belfast, is about. GP Federations are something fairly unique to Northern Ireland. It came about in 2000, I think it was 2016 that it came about, and really what it was to do was to basically transform health and social care for our patients. And there's 17 federations within Northern Ireland, and North Belfast is one of them. And just there on Friday, we have heard now that hopefully we are going to get a multidisciplinary team into our practices in North Belfast. So we're going to have lots of other healthcare professionals within the team to be able to, help our patients, which will be great.
That's amazing. I feel like there's nothing you can't do. I'm
Oh,
gonna have
there's
to
plenty.
say
I can't cook, and
oh, really?
I can't cook, and yeah, I'm fairly useless at quite a number of things, but yeah, I think with my job, I try to ensure that I'm the best that I can possibly be. And again, with the Berkeley Aesthetics, it's to be the best practitioner that I possibly can be for myself and also for my patients as well. So it's always striving to have not perfection, perfection doesn't exist, but to strive for excellence. That would be
And
what I would, yeah.
well, one of the things I wanted to ask you about is I know you were nominated for the Inspiring Women Awards, I think by Women in Business in Northern Ireland. And
Yeah.
one of the things that you mentioned before, which I think is so true, is one of the difficulties if you want to go into private practice, is we as NHS doctors and having gone through medical school, we don't get any training in business.
Yeah.
I think it's something that's very difficult to go into coming from an NHS job or background.
Yeah.
So how did you find that? Was it a struggle, or do you have any tips for anyone who's sort of looking at that as a future step for their practice?
Yeah, I mean, I suppose, again, using the skills of running my own business, which is the GP practice, it's about making sure that you're committed. You've got to be committed to this. You will sacrifice things, okay? So you will have to sacrifice. Having good mentors around you, so having good people to go to ask if you need any help. Um, I would say, making sure that you develop your skills in being able to do other things that are not medicine related. So financial things, business management, social media, marketing, all of those things. The Women in Business is a great support to the clinic, and they help with the non-medical things. But obviously you'll learn along the way too. You'll learn from your mistakes more than the things that have gone well. But just being open to learning all the time. I think you've got to make sure that whenever you go to open up a clinic, that you research where you do your training, making sure I did my training with Harley Academy. So making sure that you research what you're going to do and realize that that is just a platform to be able to start the business. So you've got to constantly be doing CPD. You're constantly having to think about going on courses and developing your craft and your skills, and making sure, as you say, that I suppose again the skills that I've brought from general practice is that we would have very, very tight clinical governance structures. So everything I have in my own GP surgery, I implement into my own clinic. So we will look at auditing things, we'll look at infection control, we'll look at any how your note keeping is, you're reviewing things. One of my roles is a prescribing chair for the Health and Social Care Board, and your prescribing has to be on point. Why you're prescribing it, what are the side effects, what would you use if you didn't use it, making sure that you know your emergencies, making sure that you know how to treat complications if they occur. So it's about making sure you've got all of your ducks in order, and then before you start going into it, what I would say to you is to make sure that you spend time researching how you want to run that clinic and then run it, rather than thinking, oh sure, I'll just do it piece by piece and I'll just learn along the way. That to me is not safe medicine. you've got to make sure that you get everything in order first, and then develop it further then after that. And to have a close contact with other people, in the same industry as you. Yes, there are lots of clinics here, and of course there are. I'm sure there's lots of clinics in the UK as well that are doing similar things, and they shouldn't be seen as competitors, but rather peers. And so we have we're going to be developing a small group of kind of local aesthetic practitioners and skin doctors to be able to learn from each other and to support each other. And there's enough work out there for everybody, so it's about making sure that we learn and just share our knowledge. And that's what what you'll be doing with your appraisal. Like, you now have to do appraisals every year. You're revalidated every 5 years for your license. So again, if you're going to go into private medicine, or if you're going to go into skin or aesthetic medicine, you've got to make sure that you are doing your CPD and make sure you have your appraisals, making sure that you revalidate, and getting feedback from your patients, getting feedback from any colleagues that are working with you. That is crucially important.
So and I know there are different organizations out there in terms of sort of adding a little layer of regulation to medical professionals. So there's things like JCCP, Save Face, BCAM. Are you a member of any of them, or do you recommend any of them?
Yeah, I would recommend them. I think that it's important that we probably, we all as practitioners work with each other to try and regulate this industry. I've only been really kind of operating now for the last 2 to 3 years. So there are lots and lots of colleagues that are more experienced at this industry who have been through a lot more. But certainly in the last 2 to 3 years, I can see where there's gaps. And again, using my experience where I've kind of getting to the maximizing of leadership within general practice, I would love to take some of those skills of leadership within kind of aesthetic medicine and private medicine to be able to ensure that there is good quality, effective care, and it's governed, and there's lots of governing parts to it. And I think that that'd be a real fantastic thing as a profession that we could come together with and be able to ensure that our patients are kept safe, because it is quite frightening how unregulated that it is.
Yeah, it's very, very frightening.
Yeah.
And it's hard to know. I mean, I agree with you. I think as a profession, we have, a responsibility also to our patients to kind of come together and push for more regulation.
Yeah.
And for ourselves as well, in a sense that there isn't a set training pathway to do these procedures. So technically, people can invest as much time in training as they want to, and do what you did, make sure that they're very safe and experienced before they jump in. Or actually there are people who don't necessarily do that and don't necessarily practice as safely.
Absolutely. And you're right. And I think that the only where that kind of is born from is us as the profession. It's us that have to be able to lead and to be able to set an example and to kind of think outside the box, come out of our clinics, talk to each other, and develop that further. And certainly after being able to do that within my medical NHS role, I think it's doable within the private skin and aesthetic kind of world of things as well. So I think it's hugely important that as a profession we come together. Even some of the work that I've been doing recently with as chair of GP of North Belfast Federation, when I was saying about we were working with primary and secondary care. This is the first time, certainly in my 15-year career, that I have seen primary and secondary care working so closely together. But in such a short time, since really last summer, after COVID hit us, the amount of work that has come out of that and the amount of positive work is quite incredible. So if we apply the same equation to our skin and aesthetic industry, imagine what we could achieve as a profession coming together to be able to make sure that it's the best that it can be. And it's down to us. It's down to us to be able to do that.
And I hope that's something that we're able to do looking ahead. I really do.
Yeah. Well, it'll hopefully be one of my goals. Hopefully.
Yeah.
I'm always setting goals, Emmaline. You worry with the day I don't set a goal.
And are you looking forward to being able to reopen soon?
Yes, I cannot wait to reopen. So it's been tough, hasn't it? You know, it's
Yeah.
we've missed our patients, but luckily during this period of time, I've still been running virtual consultations with patients. So I decided early on in the COVID pandemic that I was going to um, do those consultations complimentary. So I haven't been charging for my consultations when you come to Berkeley Aesthetics. And I just felt that that was the right thing for me to do for my clinic. And so every patient has got, as I say, complimentary consultations as a new patient, and of course any existing patients who have continued to go on their treatment plans. Obviously, a lot of it has been quite heavily concentrated on skincare. It has just rocketed. People are more conscious of their skin. A lot more people are doing Zooms and Microsoft Teams and other virtual kind of platforms, and they're seeing themselves all the time. And I think just there is an undercurrent of stress that everybody has during this pandemic. Whether you think you're stressed or not, there's no question of a doubt a pandemic will give you an undercurrent of stress. So with all of that, I think people have noticed that they've aged a little bit and they want to concentrate on their skin. And like I say to all my patients, I mean, there is no point in me doing any injectable treatments on you if you don't look after your skin. To me, that is a waste of time, because you're not going to get the best version of what you're wanting to achieve or the best version of you unless you look after your skin. So there are very, if any of my patients that would have injectable treatments that don't look after their skin with me. So I think that's really important. But yeah, the skin consultations have rocketed. So over the last maybe 3, 4, maybe 4 or 5 weeks now, I've probably had about 50 new patients who have been coming in for skin consult. Well, sorry, not coming in, but virtually for skin consultations. So what that involves is me sending out a Zoom code. Then you send me photographs of your skin prior to the appointment. I spend time looking at the skin and assessing it in my own time. And then obviously, as you know, being a medical practitioner as well, you then spend time taking the past medical history, the drug history, the allergies, and all of the other parts of systematic questioning and absolutely everything to be able to then make a informed decision about what it is that they need to kind of go forward with. And usually then I begin them on an Epionce skincare routine. And then when they need products, they can either collect it, and obviously they don't see me, so they collect it outside the clinic, or then I get it sent in the post. And then we keep very, very close contact on a weekly basis. And then they update me with photographs and we change the routine as and when we need to do it. But I keep a very close contact on them, particularly in the initial stages whenever we're beginning the treatment plan. And then whenever hopefully I open, then we can start doing treatments, which will be absolutely fantastic. It'd be lovely
And
just to
seeing
see
people
everybody.
in person.
Yes, to see people in person. It's quite incredible, you know, how much you miss seeing patients. The only patients I've seen really since the start of this lockdown are the patients I've given COVID vaccines to in my NHS practice. And bless, do you know what? It is just so nice to see them. And bless them, some of them actually cried whenever they came to the surgery because I think they were just so emotional about getting the vaccine, but also, you know, some of them, you know, actually quite a number of them said, you know, that was the first time that they had been out. That was the first
Yeah.
human contact that they had, and that they had missed the surgery, you know, and gosh, it was very emotional, I have to say, to see some of our patients. It has just been such a challenging time. So that human contact we have desperately, desperately missed. And I have to say, coming out of this, I definitely think we are going to have a newer, better way of living We've got to learn, and I think what we have light at the end of the tunnel at the moment. We just got to
We
stay
do.
tight.
Yes,
Stay tight.
stay positive.
Stay
Yeah,
positive.
it's very hopeful at the moment, and I hope we stay on track. Because
Mm,
the last thing anyone wants, of course, is that, there's another lockdown or another wave. Um,
yeah.
but I agree with what you said, that I think coming out of this, I do think, for a lot of people, there is a newfound appreciation for all those things that we took for granted. Like, a year and a half ago, we never would have imagined anything like this happening.
No.
Even if you're like, I was a biology major in college, like I was aware that there's probably a chance that a global pandemic would happen at some point in the future, but it's a very theoretical notion. But like the reality of it, it just never feels like it could ever happen.
Yeah. Yeah,
Um,
absolutely. And I don't think anything ever prepares you. And I certainly
no,
that, as I say, that 12th of March, it sticks in my head. And the day that we literally pulled down the shutters of the surgeries to try and manage some of this, you
yeah,
know, we did not know. But again, as GPs, what we just do is we get on with the job. And, we, as I say, in Northern Ireland, COVID centres were developed within 4 days, a brand new concept.
amazing.
We kept patients as safe as what we possibly could in the circumstances. We kept the GP surgeries clean. We kept managed to protect our staff. We continue to teach medical students. We continue to train our doctors to become GPs. And then amongst all of that, obviously, I was continuing to work in Berkeley Aesthetics and keeping patients as safe as what I possibly could. Actually, which was really, again, we were going back to what you were saying about being an NHS doctor and using the skills. I have to say, having worked in, obviously I worked in COVID centres, I learnt how to effectively manage infection control. I think nurses are far better than this than doctors.
Yeah,
We are not as good as nurses. And I have to say that I learnt the details of what it was to keep patients safe from the COVID centre. So I was able then to adopt that practice into my own private practice in Berkeley Aesthetics. So I was 100% convinced that I knew I was doing the right thing to keep all of my private patients safe, which again was very, very kind of reassuring for me as a practitioner that I knew that they were safe, because
yeah,
that's
I think
that's your priority, is to keep them safe.
absolutely. And I think there will be, quite a few changes that we'll incorporate into our own practices going forward. Just even, as you said, having an increasing awareness of infection control.
Mm-hmm.
Um, and I wanted to ask you, is there anything that you're looking forward to the most once lockdown, starts lifting?
Oh, this is an easy one. So I haven't been in my family home since the 12th of March last year, and that was really just to ensure my older brother and I are both doctors, so we were both working in COVID centres, so that instantly put our families at risk of developing this virus. And I don't think you appreciate how, again, the heroes in this to me are our ICU colleagues, but you don't appreciate until you've worked in COVID centres the amount of things that you've got to do to decontaminate before you
Yeah,
go into a house. Like I had a set routine when I came in that I had to, when you're stripping down, you're washing, you're having to then clean down. It was such an ordeal. And I knew that I wouldn't have been able to have done that in my family home because I was going to put them at risk. So I haven't been in the house since the 12th of March 2020. So that is an easy answer, which is that I cannot wait to be in my family home. And again, those things that we take for granted, tactile, hugging,
yeah,
just being with people, um, having that free spirit of just being free spirited, being content, not having to worry. It's really exhausting during this pandemic to have to, you're always thinking, am I 2 meters beside someone? Have I
yeah,
washed my hands? Have I alcohol down my hands? Have I touched you're not touching your face? Because how many times do we touch our face during the day? I've never been as so aware touching your face, but it's exhausting. And I will be quite happy to, not have that constant worry about alcohol gel, washing my hands and decontaminating, and I'm quite happy to give my scrubs in. I loved my scrubs at the start because I thought, gosh, is this really lovely? You've got scrubs on, you don't have to think about getting your, your outfit ready for the day. I am absolutely sick of scrubs and trainers. And it's so nice, Emmaline, to be able to actually get dressed up today and to have my hair down. Normally it's in a bun when I'm working. So it's, being able to actually go out, and I absolutely love fashion. So being able to get my heels on again and go and cruise about, go out to nice restaurants, go out. I love socializing, can't wait to travel. I'm traveling quite a bit, so always love to do that. So lots and lots of things. I have a list of things that I want to do when I come out of COVID. I don't know about you, if you have a list, but I have definitely
I'm
a
the
list.
same. I mean, I'm similar to you in that the number one thing for me is I just want to see my family. I want to,
Yeah,
be able to hug my mom and dad. It's my dad's 70th this year, and the plan originally had been to have a really big, lovely family
yeah,
celebration with him, and obviously none of that
that
could
can
happen.
happen.
And then again, that constant like anxiety and awareness of coming home from the hospital for me, like decontaminating everything, scrubs
Yeah,
immediately go,
yeah,
hop in the shower because my fiance, he's quite fit and well and everything, but he does have an underlying health condition, and that was just always a fear in the back of my mind, like I'm
absolutely.
potentially bringing home, something to him, but
Yeah.
then also I can't not go to the hospital. I can't not, I can't opt out of this pandemic. Like I'm a doctor, I need to be
Yeah.
going in every day. So,
It's
you know,
amazing how the feeling of responsibility, or, then that would move to accountability if anything, God forbid, happened. So it is a real worry and a real stress that I think every healthcare professional, including the cleaners of hospitals, who are
yeah,
just quite amazing people, to the
yeah,
administration staff, to the nurses, to the doctors, physios, OTs, everybody that puts their lives in front of their family life. When you become a healthcare professional, you dedicate your life to that job. It's a vocation, and you sacrifice. And sometimes we have sacrificed spending time with our family because we know we have got our job to do.
and I do think looking back, I think everyone who was a frontline or key worker in any capacity, I mean, I think we'll be able to look back and be quite proud, of the way everyone sort of pulled together
Yeah.
and got through this.
Absolutely, and particularly in this lockdown, it's the resilience that people have. Now, don't get me wrong, as a GP, I am being becoming more aware of the effects of things like long COVID and the effects of mental health, and also the effects of our children within the healthcare system that have been most vulnerable during this pandemic. I'm becoming very, very aware of that, and we are trying to think of ways to be able to manage that coming out of this pandemic. But the qualities that people have shown have been quite incredible.
Yeah.
And I hope that everybody is proud of themselves to be able to kind of get through this very, very difficult time. But I hope that everybody appreciates things even more so whenever we come out of it. But I
Yeah.
also can't believe how many less infections other than COVID that we've had. um, yeah, it's been quite incredible. I was talking to a friend of mine who's a consultant pediatrician in our local children's hospital, and she was saying in Northern Ireland, within the Belfast, certainly the Belfast hospital, there hasn't been one case of bronchiolitis this winter.
Really?
Isn't that quite
Wow. That
incredible?
is, yeah.
Not one case. So
Wow.
we're doing something right, managing to wear masks and washing our hands and staying apart from each other. So you never know. I don't know what's here to stay and what isn't here to stay, but certainly there's been a lot of lessons learnt.
Yeah.
Across everything between frontline, infection control, nursing homes. There's been lots and lots of learning for everybody.
Yeah. And we'll look ahead to brighter things.
Absolutely, absolutely. There's got to be better times ahead.
Yeah. So look, thank you so much for giving me an hour of your time
Not a
and
problem.
chatting through your amazing career with me. It's been brilliant just hearing about all the different things you do. Like I look up to you so much.
Oh, bless
I'm so
you.
grateful that you've taken the time
No, not
to
a problem.
chat.
It's been an absolute pleasure, and yeah, no, look, we're here always to always support each other. And if there is anybody that wants any advice on career or skin or aesthetics clinics, and I can be of any help to them, then they can contact me through, yeah, the Dr Carla Devlin page or Berkeley Aesthetics page. So I'm more than happy to be of help to
Amazing.
them.
Amazing. And what are you going to do with the rest of your evening?
Oh, I'm going to relax, I think, this evening. Had a lovely
Yeah.
day. Had dinner earlier on with my family in the conservatory, of course, which is barriered off from the rest of the house. So I think tonight I might just sit back and relax and maybe watch some Netflix. I think maybe tonight. Yeah,
That
it's quite
sounds
enjoyable.
great.
I actually don't know what to do with the time. You know, I know, but back to work tomorrow in the clinic. So I'll be doing all virtual consultations tomorrow and also just doing some administration for the clinic as well. And then back to the NHS job on Wednesday.
Oh gosh, it never stops.
Never stops. It's all good though. It's all good. Well, it's been a pleasure, Emily. Thank you so much for giving up your time as well. It's been an absolute pleasure to
Of
talk to you this
course.
evening.
And enjoy your nice, well-deserved, relaxing evening.
Thank you so much, and I hope you enjoy your evening too.
Thank you.
Okay. All right. Take
Bye.
care. Bye, Dan. Bye bye.